Morning, 9 o'clock. Yes, on the dot. And you're locked in with the doc on the rock. We're gonna take this thing all the way to the top today. We got Matthew Farley, who is the principal for Garrison High School. I have great respect for this gentleman. And, yes, we're not gonna stop until we drop. Or when the clock stops at 9:30, of course. So, every Saturday, 9 to 9:30, VOB, you tune into Living with Dr. Sparman, and we talk about just breathing and living, you know? And every week, every day, you thank God for those days. And we talked about the last few weeks, we talked about sexually transmitted disease and basically how we approach this type of stuff and sex and protected sex and so forth. Today, we had a little bit heated topic there last week. We talked about how parents feel about children being educated about sexual activity. We talked about sex at lunchtime, SALT, and all those things. And I want you to call in today. You call in and let us know. We have Mr. Farley here. He's going to talk to you. This principal knows all about kids and how we should bring. He's as a matter of fact, molded a lot of our leaders today. And he's going to tell you about what his take is about children and how we should teach them. You know, if we don't teach them, the parents don't teach them. The children will teach them. And if you're taught wrongly, then bad things happen. So we want to get things very early. 9 o'clock every Saturday, 9 to 9:30. VOB, Living Life in Itself. This is your program. You got a chance to express your views. We got half an hour. Call the kids, call the your neighbors and your grandchildren and your neighbors and your friends and anybody. Let them call in. Call these numbers, 434-1771, and talk to Mr. Farley. He will give you his take on this extremely sensitive topic, sexual guidance to children as they grow. Matthew Farley, a man who I have a lot of respect for. I've met him years ago, and a man of good honor, actually. And we'll talk to him. Don't forget those numbers, 434-1791, 434-1790, and 434-1771. Now, listen, guys, you can tune in. All of this every Saturday. It's on YouTube now. If you put in Dr. Sparman YouTube, you'll see Living coming up there, and all of our program, surgery, everything you want to say, all the topics we've been discussing, it's right there. So if you miss it, you had to go to the market this morning. You just pressing Dr. Sparman there on the computer and on YouTube, and you'll pick us up and you'll get this program there. So good morning, Mr. Farley. How are you?
I'm fine, Dr. Sparman. Good to be here.
I want to thank you for coming. You're busy. You got a lot of stuff going on in your life. I mean, you got the whole Garrison there in your hands. You can't sleep because you're thinking about your kids all day. Tell me, what's it like to be a headmaster of a school and have this weight on your shoulder?
Well, I find it rather inspiring. My mother tells me that from the time I was a little boy, the first day I went to school, when I came back home in the evening, I said I wanted to be a headmaster. That's what she said. I don't remember, but she said so. It must have been so.
How old?
That would be 5 years old. That's what she said, and that's mother said so. It must have been so. But I have a passion for my job. I don't think I've ever wanted to do anything else. I've never wanted to be a doctor or anything like that. I always wanted to work with children, and I love what I do with a passion.
Well, what is it? What is it? I mean, from what age you really realize that just hanging out and talking constantly to little kids that is younger than you, that really had a passion for that?
I think that from my teenage years, growing up in the church at Newbury St. George, I saw it coming through. But I must admit that when I got into training and you start to explore all these various philosophies of education and, you know, what you can do and the impact that schools have on developing personalities of the child and so on, you recognize in truth and fact that the teacher is really a powerful figure, powerful variable in the lives of children. And that's where it's at.
And it's in the fabric of every society, too.
Oh, yes.
How do you feel now when you meet a young man who's extreme, well, he's very successful, he's a doctor, a lawyer, or teaching it himself? You've taught this kid from a young age. How do you feel?
That's one of the joys of the profession. And our satisfaction doesn't come daily. It doesn't come in one lesson. Sometimes you pass a whole term and you don't feel as though you achieved anything. But then one day you're walking down Broad Street or you're somewhere out there and somebody says, "Sir, you remember me?"
Oh, man.
And you probably don't always remember the name, you remember the face, and you say, "Oh, yes. You mentioned the school.
Yeah.
That's when you get some satisfaction that all was not lost.
Oh,
and sometimes those are the guys who give you the most trouble.
Is that so?
Sometimes.
Man, I feel the same way, and I can relate to that because I know when I fix somebody up, I know if I don't touch them, they're gonna go. They're gonna check out and go to the other world.
Yes.
And I go and fix them up. The next day, I see them smiling at me. I get some satisfaction.
That's where satisfaction comes.
Teaching itself. I mean, it's really you teaching the people for tomorrow. In other words, you're building a society for tomorrow. And I think you guys are extremely important in any type of country per se, or any fabric of any society per se. Because would you teach us?
We teach everybody.
Exactly. Exactly.
We teach all the professions.
Exactly.
They almost pass through us.
So let's just go to the topic now. What do you feel about, how do you feel about sex? First of all, we had some gentlemen here the last few weeks. We were talking about sex in the classroom. A lot of times they're having this problem. Kids are coming in, they're having sex, and these group sex and unprotected sex and all this type of stuff. It's a real problem. And the thing is, by the time the parents realize what's happening, it's late. Pregnancy, sexually transmitted disease, some of which cannot be cured and so forth. What is your take about sex education in schools?
Well, let me say that the Ministry of Education, Dr. Sparman, has a policy where across the primary and secondary sector, it has to be taught. It has to be taught. It comes through your religious and moral programs. It comes through your health and family life education program. And of course, many schools have a guidance program that provides information to young people. But I think the moot point that has to be focused on today is the question as to sex education. Where's the best time? At what point should you provide students with children with that kind of information? Who is the best person to do it? Of course, there's some people who believe that's not the role of the school. There's some religions who tell you that it's not your job to tell my child about those kinds of issues. The reality is that I don't think that there is any right time or wrong time. I think as parents, you have to be sufficiently sensitive to what is happening in your child's life to find the teachable moments. Children are not clones of each other, and therefore a child in your family will perhaps get exposure earlier than a child in my family or somebody else's family. So you have to be sufficiently sensitive to know when is the best time. You may be watching a television show, and in the show there's some particular issue that comes up that triggers a moment for you to say, okay, maybe during the ad, or maybe even after the program, or maybe next morning at breakfast, you can say, okay, you remember that show last night? And there you could. You might be driving into the country, Dr. Sparman, and you might see two animals mating. Yeah. That might be a point. And
exactly.
And the child might say, Daddy, what's that? You know? But I don't think there's any magic age or any magic point. However, if this question were being discussed in 1912, I think the response would be different from 2012. Because the reality is that parents and schools no longer have any monopoly on access to information. There are 5-year-olds now who have BlackBerries and who can surf the internet. The information is out there. So it means that it is even more critical that parents understand that they're competing now with other sources of information, and that they have to be on top of it. They have to know what is happening. Exactly. If they don't know, they have to know where to refer the child to on the internet to find the information, because if you don't give it to them, somebody else will, and perhaps the information might be warped information about sex.
That's the point I'm getting at, because if your 6-year-old child in school can learn about sex and all the intricacies of sex from another 6-year-old who probably went in the bedroom and saw mommy and daddy mating and all these type of things. So would you say that if you have a 6-year-old child, would you feel comfortable sitting down and saying, well, you know, Rihanna or Betty, you know, you need to know about, normally you make babies when two people come together and so forth, but you shouldn't have sex until you're an adult. But if you should have sex, you use condoms. Do you think that's too early?
I don't want to say it's too early. As I said earlier, as a parent, you must know how much your child can take, and when the child is ready, and look for those teachable moments. You still don't want to give too much information too early, because children might not be able to handle the information.
Gotcha.
But you might give it in small bits. You know how do you eat an elephant? How do you eat an elephant?
How you do what?
How do you eat an elephant?
Oh, you got me on that one.
One
a bit at a time, I guess.
So you have to give it to
take you years, actually. You got me there.
So you give it to them in small bits, but recognize that the information age is with us now, and that you do not have a monopoly either as a teacher or as a parent on what information and how much information children at any age have access to. Children are watching cartoons, and in those cartoons there are lots of sexual images and messages being sent.
I know.
And sometimes parents don't recognize that.
I know. Things just keep plugging in. He's talking about eating an elephant. I'm a vegetarian. I said, my God, what do I do? We have a caller?
Yes.
Yeah, go ahead. Morning, you're on the air.
Good morning, sir. Good morning, Doc.
Good morning.
First, I want to thank you for taking care of the health sector in Barbados and doing a great job.
Thank you, sir.
My question today about the sex education there. At what age do you think children should be learning about the sex education in school? So you start in primary school, secondary school?
All right, thank you for calling, sir. I'll let Mr. Farley answer that.
As I said earlier, at the primary level, there are opportunities in the religious and moral program for children to be exposed to basic facts about human sexuality, how children grow, how they develop, the difference between boys and girls. So way down in your infant department, boys are learning about differences in the body parts and the role and function of body parts and so on. So from early in the primary school, you can give them bits of information about sex education and human sexuality. But as I said, within the family context, parents should be sensitive and alert as to when occasions present themselves for information to be shared with young children.
Yes, I agree too. I mean, you have to, in every individual, I think you have to assess the situation. Some children, but the matter of fact, the funny thing about the whole thing is that whether you want to learn or not, even if you try to close yourself in, the bombardment from all the areas.
That's the point. We live in an age where there's sexual images everywhere. Every consumer item is associated with sex, with human sexuality. And I think that while the world of advertising and all that comes with it promotes sexual images for their own benefit, I think parents need to recognize that is impacted on children's sense of human sexuality, and they get a sense. Okay, I want to buy a new car, and there's a woman's leg over the bumper. How do you mix the two? And children get all excited about those kinds of things.
Guys, you're linking, man. I tell you, we got some. Listen, you guys got all this wealth of information. You got all the questions you can answer here. You just call, and you'll be able to speak to Mr. Farley in reference to early education of sex. Dr.Sparman, thesparmanclinic.com. Don't forget to visit the website, www.thesparmanclinic.com. And as I said, you can just visit YouTube, just punching Dr. Sparman there, and you'll see all the programs showing up there. We want you to call us at 434-1771, 434-17-1991, 434-17-90.
434-1790-1771.
Yeah, good, all right. Children, they're the people of tomorrow. I have an avid interest in them. As a matter of fact, sensitivity to children, because I see in them myself growing for the next generation to come. I consider myself a child too, because I always tell people I'll live forever. We got a child. Who, you got somebody in the line there? Good morning.
Hi, good morning. My question today is not about the children. I was trying to reach you so long. It's about breast cancer. I got breast cancer, but since last year, August last year, I had surgery, right?
Mm-hmm.
And I have radiation yet. I just want to know if I must take the radiation or whatever.
Well, the questions would be, one, if the breast cancer went to any other part of your body, if it went into your axilla or on your armpit, or if it's gone to your bone, your brain, your lung, and those type of things. If it's localized to your breast, this is my opinion now. If it's localized to your breast, some people do this thing called lumpectomy, where they take a piece of it out, get the margins out, and leave the rest in. I tell my patients, I says, no. If you got cancer in any part of your body, take that organ out. Take it out, because, I've seen a lot of people 2-3 years down the road come back with a recurrence of the disease, and this time it's gone to the lung, and that's the end of it. So if you got breast cancer, as I said before, some doctors may have different views about it. But in my 30 years experience as a physician, I've seen too many recurrences. You got breast cancer.
I already have the surgery.
Good. So if the surgery has been done already, then what you do, you just, if they recommend chemotherapy and radiation therapy.
I just all that already.
Yes, go ahead. Go aggressively, ma'am.
So I must have the radiation?
Yes, please do. Live longer. Okay?
Thank you very much.
Thanks for calling.
Yeah.
Yes, we get calls. We're talking about sex education. Thank you for calling, ma'am. And, you know, we answer all calls because that's what we're here. We're about living and live it. You encompass all type of illnesses, all type of diseases and so forth. But the sexual transmitted disease, you see, it's not only early sex. It's not only early sex, but sexually transmitted disease you get from this stuff. And I mentioned last week that herpes, HIV, and some of those things, papillomavirus, can cause cancer. So a lot of stuff can happen as collateral damage from sexual activity.
The other point before you take a call is the question of accuracy of information. Right. Because if parents and schools don't provide the information, there are persons there who are willing to distort and to give information that will mislead students and to lure them into early sexual activities against their own health and wealth.
You see that? That's well said.
Because there are persons out there, guys on the block, on the corner, or wherever, at school, who will be prepared to give the information if you don't want to give it as a parent or as teachers. The information is out there. And we want to make sure they get the right information that will impact on them in a positive way in terms of how they see human sexuality. Human sexuality is a healthy enterprise, and we should not allow it to be distorted by any source.
Exactly. Know what's normal. Know what's the truth first.
Precisely.
Yeah, I agree. I agree with you. Got a caller? Yeah. Good morning.
Hello. Good morning, Mrs. Sparman. How are you doing?
Yes, hi. You're in the air. Thanks.
Well, I know this is a little bit off right now where you're talking about sex, but I have both of my shoulders and in the joints, they hurt like crazy, especially in the night and maybe hours in the morning. During the process of the day, nothing happens. It don't hurt. But in the night and maybe hours in the morning.
How old are you?
I'm 57.
Yeah, you got pain in your joint. A lot of times it's arthritis, but we always tell patients just to make sure it's not something else. In your trunk, anytime you got discomfort or changes in your in the way you feel about your trunk, meaning your chest wall and back and all those areas, make sure it's not your heart. That's the one that's going to take you. Once it's not your heart, then you could be treated for arthritis. Thank you for calling, sir.
Thank you, too.
Pleasure. You on the air?
Good morning.
Yes, good morning. What's your feeling about children being educated early about sex in schools?
I am 37 years old, and every morning about 5:45, I have the numbness in my right hand, fingers, and it's very painful.
Oh, all right.
I'm a diabetic and blood pressure and bad circulation.
Yeah, you probably should go see your GP, actually, because basically you're 87 years old and you're having pain in your arm. It could be sleeping bad, but we don't know. I mean, you got diabetes, you got high blood pressure, you got cholesterol problems, you're high risk for heart problems. Go see your GP and get an EKG and evaluate it to make sure there's nothing serious, okay? Because sometimes these symptoms are very atypical. They don't present as the textbook would say. Thank you for calling, ma'am. Yes, give me some of your thoughts, Mr. Farley. I want to learn too. Tell me what you think about when you see little children growing up. I mean, you know, long ago it used to be everybody was striving for virginity. 18 years old and after, it's okay. But now kids are having sex 7, 8, 9, 10. I mean, how people deal with this stuff?
It is worrisome. When you talk to young people, and I have a lot in my school, I have 900 of them. Every now and again we have a chat, and their notions of the morality of human sexuality are different from your generation and my generation. I think this has a lot to do with the exposure to the media, and a lot of the movies and a lot of the information they suggest that a lot of things that used to be black or white, you know, they're now many shades of gray, and therefore they're girls who believe that the sooner they give it up, the better. And there are those who believe that because they have not given it up, they don't want anybody to know, because otherwise they stick like sore thumb. So I think many young people find themselves in that dilemma, to give it up or not to give it up.
So you're ostracized.
Yes, precisely. And I think that parents need to recognize that this is happening, and therefore make sure they have the early impact on their choice understanding of human sexuality, given the positive role it plays in their overall development.
Listen, we want to hear your input. 434-1791, 434-1790, 434-1771. You call us. We just got a few minutes left. I want to thank Mr. Farley for coming. What would be your last few? Let's give you a minute of voice about this whole topic to the nation.
I think the first responsibility for sex education rests with parents in the homes. And therefore parents need to equip themselves, put themselves in the know, so that they could provide that kind of information for their child from very early. And they will determine how early is early, because it varies from each child, since children are not clones of each other. In terms of the role of the school has a role to play as well. Even though we're not the most attractive in what we do, we are strategically placed in the lives of children, and therefore we have to recognize that where parents fall flat in terms of the accuracy of the information, the school and the teacher, given the way children perceive us, we also have a role to play. But I think there has to be collaboration and agreement, because the school can't be teaching one thing and the home teaching something else. So there has to be some kind of consensus, some kind of agreement as to what are the facts, what are the issues, what are the moral bases on which our sex education programs must rest.
What do you do when you, if you're going to discipline a child, you find that a child, you got the reports that a child has been sexually, 12 years old, 13 years old, sexually active, you get this report, what do you do? How do you discipline these children?
Well, I don't think that it calls for discipline there. What you need intervention. You need to get the parents in to see whether the parents are aware. We need to know who is the person involved in this situation. And very often, Dr. Sparman, we find some frightening situations where there are big, hardback men who are preying on young girls. There are a lot of girls 13 and 14 who are becoming pregnant for men that are 19 and 20 and 25. And sometimes parents find themselves almost aiding and abetting in those kinds of circumstances. It's frightening sometimes. So it's good you're talking about sex education, but I think there are other issues that are related to sex education. We see able-bodied men interfering with
young. So a lot of times it's not even the school children. The males are not even school children per se.
They're not.
Outsiders.
They're not. And I think that parents have to be vigilant and recognize that they have a role to play in guiding their children. Sometimes there are financial issues that see children being used by mothers, daughters being used by mothers as a means of getting money and getting things for the home. You have mothers who attend their children, you're of age now, go and get this, I have to get money to pay the light bill and so on. I mean, this is one thing to talk about sex education, but the number of related issues that are rather frightening.
Drive people.
Of course, and of course, it's not just the girls, the boys themselves are equally vulnerable.
Oh my goodness.
So me, that's of another program, but these are issues that we need to explore.
Yes, this is, and then we even talk about sexually transmitted disease in the schools. There's so many things to talk about. Yes. Listen, you're tuned in to VOB 92.9. Our time is short, but don't forget, we might extend this program for a longer period of time. This is February. Aquarius, don't forget, we got the party coming up. We may push it back a little bit because we're gonna maximize on the individual company. We're trying to get Bruno, but listen, I'll keep in tune every Saturday. Let you know what's happening. We love you. Thank you for listening, and I want you to have a very good day and a good week until I see you next time. And I'll see you next Saturday at 9 o'clock.